歡迎各位。
Welcome to today's press briefing on the updates of COVID-19. We have with us Undersecretary for Food and Health, Dr. Choi Tak-yi, and from the Center for Health Protection, Head of Communicable Disease Branch, Dr. Chang Shok-kwan, and from the Hospital Authority Chief Manager, Dr. Larry Lee. We'll first hear from the Undersecretary. Good afternoon, everyone. Since the start of the fifth wave, children and elderly people have been affected by different degrees. So far, we have suitable oral medication for COVID-19. And if they are prescribed early, well, then it will be very good for them. And, well, we have starting from next week, we will provide free RAT kits to elderly people to encourage them to get tested. These are the details. Starting from Tuesday, that is from the 19th of April, members and service users above the age of 60 of the following service units can obtain RAT kits from about 680 service points. These service units include District Health Center and DHC Express, Elderly Health Center of Department of Health, District Elderly Community Center, Neighborhood Elderly Center, Social Centers for the Elderly as affected by the Social Welfare Department, and Social Welfare Department's affected Daycare Center or Unit for the Elderly, Integrated Home Care Service Teams, Enhanced Home and Community Care Service Teams, as well as recognized service and centers under the pilot scheme on community care service voucher for the elderly. On top of that, there are also Chinese medicine clinics, training and research centers run by the Hospital Authority, NGOs, and local universities. In relation to frail or mobility impaired elderly people who have been receiving home care service from relevant units, the outreach team will bring with them RAT kits on their next visit. And in order to help elderly people understand how to do RAT, rapid antigen tests, we will enclose a points to note on the use of COVID rapid antigen test, specially designed for the elderly. This is something like, it looks like this. We have bigger fonts, and there will be instructions on the use of the test kits and how to make reports, as well as how to seek medical and other relevant assistance. This arrangement will tentatively run till the 31st of May. Depending on the situation, we will take stock and decide about the way forward. In addition, currently, those above the age of 70 can walk in to take PCR tests at community testing centers as well as mobile sample collection centers. When elderly people reach these stations or mobile stations, they can make use of the caring queue to reduce waiting time. Vaccination is still an important tool to prevent serious conditions as well as deaths. As at the 12th of April, for vaccination rate of first dose between the age of 7 and 79 is 82.63%. The rate for those above 80 is a mere 59.84%. We appeal to family members of elderly people to make arrangements for their elderly family members to get vaccinated. We also appeal to doctors, whether they are in the private or public sector, whether they are Western medicine practitioners or Chinese medicine practitioners. Please make use of the opportunities when you come across patients to appeal to them to get vaccinated. I'd like to remind you all that Easter holiday starts in 2 days. I understand that you would like to take the chance to go out, but please strictly follow social distancing measures. Keep your masks on, keep your hands clean, avoid crowds. so that we can gradually resume normality. But we should not let our guard down. We should work together to prevent a rebound. We can make use of RAT to achieve the objective of early identification, early isolation, and early treatment. We'll now defer to Dr. Chang. Good afternoon. We have 734 PCR tests as of yesterday. There are 538 cases of RAT positive cases. Altogether, positive cases, 1,272 cases. In the previous 3 days for RAT positive tests, we have 3,142 cases. That includes 65% of them being asymptomatic cases. For the total number of positive cases so far, we have 1,181,164 cases, of which 740,658 of them are PCR positive cases and 441,006 cases being RAT positive cases. And of the 734 PCR cases, 118 came from hospital authority, 150 of them comes from public health laboratories, and 404 of them from private laboratories. We have conducted genome sequencing on 334 cases. Those with L452R are 6. 331 of them are negative to L452R. They are Omicron cases, and there are 4 cases pending results. In relation to today's cases, there are 12 imported cases. 10 of them arrived yesterday. 8 flights, including some from Germany, Nepal, France, Singapore, Shanghai, India, and the US. There are 2 cases that previously left Hong Kong. We have not received any reports of new outbreaks in care homes, and there are 25 cases that involve the residents, and 3 are staff members from 18 care homes for the elderly and 2 care homes for the disabled. In terms of death cases, the HA has reported another 62 cases with positive COVID results. 54 of them are death case yesterday, and 8 are cases before yesterday. Altogether from the HA, there are 8,674 cases, including 9 reported from other sources. We have 8,735 death cases. Of the 8,735 death cases, we have 3,581 females and 5,154 males aged between 11 months and 112 years old. The median age is still 86. 8 are under the age of 18. And over 96% of them are above the age of 60. In relation to death rates of reported cases is 0.739. Above the age of 80 is 10.15%. Unvaccinated 2.96%. Those above the age of 80 unvaccinated 16.09%. Those with 1 dose, the death rate is 0.95%. Those above the age of 80 is 6.56%. With 2 doses, 0.16%. Those above the age of 80, 3.69%. Those with 3 doses, 0.03%. And those above the age of 80, 0.98%. That's all for my report today. We'll now hear from Dr. Lee about the situation in the HA.
Thank you. We have a total of 9,000 confirmed cases in different public hospitals, the North Lantau Infection Control Center, and also the AWE, and also the other treatment facilities. Last night, there were 6 critical cases, and out of those, 4 did not have any vaccination record and 2 had 1 shot, and 7 are now in ICU. 54 are now in ICU, and as at 00 hours today, during the past 24 hours, a total of 54 cases were tested positive, and they passed away. 24 male and 30 female. The age range was from 56 to 106. Out of those 54, 21 were from care homes, 35 did not have any vaccination record, 15 had 1 shot, and 3 had 2 shots, and 1 had 3 shots. And out for 52 were over the age of 65, and 2 were relatively young. And I'd like to share the details with you here. They were 56 female and also a 57-year-old male. For the 56-year-old female, on the 14th of March, she had the first dose of BioNTech jab, and she was suffering from multiple myeloma, and this was her underlying disease. It's also a kind of bone cancer. And on the 20th of March, she went to the Eastern Hospital's A&E department because she was feeling dizzy. And after investigation, her renal functions were deteriorating, and also in terms of potassium in her blood is also high. And after conducting tests on her deep throat saliva, she was tested positive, and therefore, given the fact that she was tested positive after she was admitted to hospital, we also prescribed the oral drug to her. But then the situation continued to get worse, and then on the 12th of April in the morning, she passed away. Another patient, the 57-year-old male, he did not have any particular medical condition. He was mainly suffering from hypertension, and he did not have any record of vaccination. On the 26th of March, in the morning, he went to the A&E department of Jumun Hospital, mainly because there was a loss of appetite, and upon checking, he was suffering from some jaundice, and various indicators on his blood were also deteriorating, and therefore we admitted him to the hospital, and he was undergoing investigation by the medicine department. And then on the 1st of April, he was found to be positive upon PCR tests, and we prescribed antibiotics as well as steroid, and he underwent abdominal, chest ray, and also MRI tests, and there were also unusual or abnormal shapes, and we noted that he might be suffering from cancer, and then his condition continued to deteriorate, and in the afternoon of the 12th of April, he passed away. So he passed away at 5 p.m. And also because of the lagging behind of data, on the 11th of April, there were 8 people passing away. There were 4 males and 4 females, and the age range was from 75 to 100, and 1,544 patients were released, and 5 were classified as close contacts. And then out of the staff, there were 21,738 staff members who were infected, and 20,680 already resumed work. That's all I'd like to report. So before you ask questions, please identify yourself and also the agency that you represent. The lady at the back. Thank you. I'm from TVP. I have a question. Well, for the Chinese medicine clinics in the 18 districts run by the HA, they provide health services, but then we are faced with millions of people who have recovered from COVID, and therefore the quota has been full all the time. So would you be increasing the number of such Chinese medicine clinics, or are you going to open more such services so that more people can be served? And also for those over the age of 70, why is it that only they are able to go and take the test at the community testing centers? Well, because there are so many vacancies, and anybody arriving there should be able to take the test. So why is it that only 70-year-old or above can do it? And also, why are they not able to do the test at wish? Well, other than the rehabilitation services, our Chinese medicine clinics are providing different services. For example, other than general Chinese medicine services that has started in 2021, and there are also care homes, outreaching teams, and there are also telephone hotlines and so on. Well, you talk about the consultation service. In fact, for those who have recovered and those who have completed isolation, within 6 months from their recovery, they would be able to go to these centers to receive 10 free consultations, so that they would be able to receive consultations for free. So about 500 new quotas will be made available. So we'll be liaising closely with these Chinese medicine clinics so that recovered patients will be able to go there and use the service. Concerning elders taking the test, we understand that they are from the high-risk group, and according to the latest information, since the outbreak of the fifth wave, out of those mortality cases for those aged over 70 and above, they have taken up a very high proportion. And if you adopt the principle of early identification, early treatment approach, then we are now having this oral drug available, and if they are identified early, then as soon as they develop the symptoms, they'd be able to take the drug, and that would also reduce mortality. And therefore, we do encourage elders to take the test as early as possible. For the rest of the details, I don't have them with me now. Sorry. Next, the man in black on the left-hand side. I'm from Dot News. Well, today we have a group that did a survey, and they interviewed some of those who had been confirmed positive, and they were also concerned about the aftermath of the disease, and therefore, would you be providing more support to those who have recovered from the disease? For example, will there be subsidized Chinese medicine consultation services for them? That's the first question. Second, in Fanling, the in Changhua, well, they were subject to restriction, mandatory testing, declaration, and then only about out of the 800 people, only 3 were confirmed to be positive. So you can see that the confirmed rate is less than 5%, and in some cases is even lower. So during the Easter holiday long weekend, if there is no continued outbreak, then would you view that as the situation being under control? Well, for the support for the recovered patients, so can you give us more details? Well, other than the 18 Chinese medicine centers under the HA, we would monitor the demand closely to see if there are other avenues available to provide the service. So that would take some time, but then we will monitor it closely. Next. For those who are subject to the RTN or RTD, we can see that we'll be able to grasp the situation more closely, and if we can see that the trend, together with other data, if we're able to get a clearer picture about the trend of the epidemic, then would be making decisions as to the way forward. Thank you. Next question, please. On the right-hand side, at the back, the one in white. Thank you.
Morning Post. So, because Chief Executive Carrie Lam said this morning about relaxing some of the, about requiring participants in the high-risk activities to undergo RAT every time they participate in those events. So, what do the CHP think those high-risk activity might be? And also the second question, there were more PCR test case than the RAT test case today and yesterday. So how do you analyze this reverse trend right now? And also about the new arrangement for handing out RAT kits to people aged over 60. How many RAT kits have you prepared, and why giving them specifically? Is taking RAT tests be a requirement before entering those elderly care homes in the future? Thank you.
Let me answer the third question first. Well, for the exercise in distributing RAT kits free to members or service recipients at a number of services that I mentioned in the opening remark, the purpose is to increase the accessibility and encourage elderly people to do more self-RAT because it's well known that elderly people belong to the high-risk group, because when we review the latest data, say on the mortality figures, among the 8,000 plus death cases, around or near to 96% belong to 60 or above age group. So, and also currently we have effective antiviral medications when given in the early stage of the illness. On symptom onset, it will reduce the risk of getting more severe or even death. So with this effective treatment measure, early diagnosis is important for elderly. So I think it is important to provide more accessibility to this age group. So we implement this exercise from next week to the end of May. Thank you.
Dr. Zhang, please.
Dr. Zhang.
I do not have the details of the high-risk activities, but I understand most high-risk activities are mass-off activities or with many people or gathering. We observe more PCR tests positive than RAT today, probably because we have passed the 3 days of encouragement of rapid test among the general public. So I think we'll observe the trend, and I still encourage people to do the rapid tests, especially those who have not done, who have not participated in those 3 days.
好，下一個提問。
Next question, the one on the right in black. I'm from Hong Kong 01. My first question, distribution of RAT kits to elderly people. It's a good measure. But looking back from the data over the 3 days RAT tests, would it be difficult for elderly people to make a report if they have a positive test? How many cases over the 3 days are elderly people? Do you think that the distribution of kits will be helpful to them? And previously, the Department of Health has distributed deep frozen saliva kits to them. Wouldn't you try to make it easy for them to report the cases? In relation to recovered students, does it mean that when face-to-face class resumption starts, they don't have to do RAT test every day? Well, the number of cases has dropped by over 90%. Just now, the Undersecretary said that people should remain vigilant over the Easter holidays and to avoid crowd. Would you give more appeal to members of the public as to how to strictly abide by the social distancing measures? I talked about elderly people receiving kits from service units. Well, that's because, first of all, the death rate among elderly people is high. Number of death cases of those above the age of 60 is quite high. The second factor is that we have effective oral medication that can effectively treat COVID. For people with mild symptoms, especially those who are of a high age group, they can be prescribed these medications when there is early identification. I mentioned about elderly health centers and district health centers and service units under the social welfare department. Some of them have a membership system. So it's not the case that we just give out the kits and that's it. We make use of the relationship of the members with these organizations so that their cases can be followed up, and if elderly people don't really know how to report their cases, they can seek help from the organizations and centers. It might be better than a one-off distribution. Your second question is in relation to the latest instructions of doing tests when classes resume. In a letter to principals and schools, well, for recovered patients, within 3 months, since they have recovered, there is no need for them to do any tests. The third question, any appeal for the upcoming holiday? From my experience in the past, in relation to holidays and the fact that vigorous social distancing measures have been in place for quite some time, people may not be as vigilant as before. That's why I remind you all not to let your guard down. If you go to poorly ventilated places, or if you mix with crowds or take your masks off, the chance of infection may increase. So we all have to abide by the anti-infection measures. Of course, now RAT kits are readily available. Prices have dropped. They are available in many different shops, and different NGOs have been distributing them in their community. So we encourage people who don't feel well, or if they feel that they're exposed to risk, they can do the test. Next question. The one on the left towards the back in white. I'm from cable TV. Now you will distribute free of charge RAT kits to elderly people to encourage them to do tests. Why not cover students? Because they are required to do RAT before they go to school. Don't they have a greater need? And what is the stock level you have for the distribution? Now that RAT positive cases outnumber PCR cases, what's your analysis? Kids don't want to do nasal swabs, and there are available kits that will test the will only require you putting the swab under your tongue. Well, what do you say about that? Is it more effective? And in relation to nasal swab, isn't it not as good for children? An important principle in distribution of kits to elderly people is that they are high risk, and they have a higher risk of serious conditions, and there are available COVID oral medications suitable for adults. The medications are proved to be effective in preventing serious conditions and deaths. So we follow the principle of reduction of serious cases and deaths. For children, if care is exercised and you do something else to distract them, it can be smoothly done.
右手邊黑色衫嗰位。
你好，3位明報嘅。 首先都想問翻，即係同長者派 RAT 套裝嗰度，一個套裝係大概有幾多個測試包呢？老人家用晒係咪就可以即係再不停咁再攞呢？另外都想問翻 CHP 嗰邊，即係提到話4月8號去到10號 RAT 情報平台上。
As mentioned that on the 8th of April, they received a total report of over 3,100 and 65% of those were asymptomatic. So will there be further analysis? And also, targeting these figures, what kind of analysis will be conducted and when will you be releasing the findings? And also, another question for the HA. Well, for the 57-year-old male who passed away, well, on the 26th of March, he went to the Treatment Hospital. Was he screened? So what's the result then? And also, after he was admitted to hospital about a week later, he was found to be positive. So, was it that he got infected within the hospital, and were there any other patients who were also infected? And also, Kiwi Hospital has also been admitting non-COVID patients. Is that the case, and when did it start? And also, what kind of patients are involved? And also, when will it be turned back to non-designated hospital? And what's the criteria you adopted in determining what kind of patients will be admitted to which hospital? And also for the Chinese medicine clinics in the 18 districts, what's the utilization rate? Has any one of them or are they saturated? With regard to the free distribution of RAT kits to elders, well, for the time being, everyone can get 5 such test kits. And if they need more, they can of course go and get more. But then for these service centers, mostly they have this membership system or the frequent users of their services, and therefore the staff should have established some kind of relationship with these members. And after they have got the test kits, or if they go back again for further kits, then they will ask them if they know how to use them and what's the result and so on. So if they need to make a report, then they can also get assistance. So that would be the way we distribute these test kits to the elders. With regard to the 3,000 plus cases from the 8th to the 10th of April, mostly we found out that a group of people were asymptomatic, and yet they also joined this test scheme, and they reported to us. That's the important message that we got with regard to the ratio between male and female and so on. I don't think there's a huge difference between them and those who had reported earlier. Dr. Lee, with regard to the Chinese medicine clinics, since April 2020, over 12,600 patients already took part, and the total number of consultations exceeded 30,000. And also on the 57-year-old male, he went to the Treatment Hospital on the 26th of March, and he was tested, and he was tested negative. That was a PCR test. And then we monitor his condition very closely. And then on the 1st of April, he was found to be positive. And Queen Elizabeth Hospital at present, it admitted COVID patients. And given the fact that the number of cases is coming down, and in fact, some of the beds have already been converted back to admitting non-COVID patients, so that we would be able to maintain our normal public hospital services. And these wards have been appropriately altered. And if there is any rebound in the number of cases, they can always be converted back to designated hospitals. We have flexibility in turning these hospitals into designated hospitals. The one in white, well, from AM 7:30. With regard to the free test kits to the elders, if some elders have not taken part in any of these membership schemes, will they be able to get those test kits? What about other avenues or venues of the government where they can get those kits? Have you done any estimate as to how many cases can be identified through the free distribution scheme? And also by the end of May, how many kits will be made available to them? And also for the territory-wide RAT tests, for the 3,140, do you have any age profile of them? And what about the elders? Did many of them report that online? And also, for the 3,142, will you be adding more later? Because that some figures might be lagging behind. And also, the CE said that the social distancing measures will be relaxed later, and during the Easter holiday, you appeal to the public not to relax or let their guard down. But then if there is a sudden resurge of cases, will you be halting those relaxation and then tightening the measures again? Well, with regard to the rapid test system or scheme, this is by way of incentive, and also is a voluntary scheme, and therefore we don't set any targets for that. And of course, we have to make sure that they will try it out, and if they are found to be positive, then they would have to know how to make reports. And of course, we will mainly have to rely on the service targets who have been frequently using the service and so on. But then where elders would like to get those kits urgently, then of course we will exercise flexibility. And if they are not members or regular members of those service centers, then of course they will have an idea as to how many people might be coming, and therefore they will set aside a sufficient number of kits, and when necessary they would also replenish the supplies, and therefore we will be doing a review in due course. With regard to the 3,142 cases, well, they have successfully registered that online, and of course a small number of them who did not do so. For example, for the 538 cases, 494 reported their positive test results online. And of course, some of the care homes would also be able to make use of another website, so that care home staff would also be able to report on behalf of those residents in care homes and so on. And they can also make use of the hotlines and also our own hotlines. And also those in isolation might also report their positive cases. For the 3,142 cases, in fact, the age distribution is from 0 to 96, and then the median age is 39, and about 18.1%, that is 18.1% are those aged over 60. And then for the male-female ratio, male 46%, female 54%. And then for those who reported by way of email, those would also be processed, but then they would not be included as part of the 3,142 because they have used alternative ways to report to us. So any further questions? Last question, please. I'm from Economic Times. Yes, you're going to distribute free test kits to the elders. Would it be too late because the peak has already passed? And also, why is it that you're not going to give them the saliva bottles? Because that would also reduce the risk that they do not know how to use the test kits and so on. And for the two death cases, before they sought consultation or before they went to see a doctor, did they take any Chinese medicine? And also on a number of people applying for such service, do you have the number? And also, are you concerned that after the relaxation or after the Easter holiday, there might be a rebound in the number of cases? Thank you. On distributing the test kits to elders for free, obviously, well, about a week ago, we distributed the anti-epidemic packs to all households in the territory, and now we are targeting the elders and also those users of specific services. So they are the members of these elderly services in different districts. I'm sure after these several rounds, many people know how to make the reports through the online system, and if elders have any difficulties, then of course their friends and relatives or family members can also help them. As they know, the health department also has hotlines to provide support to these elders. Thank you for attending today's briefing. Thank you.
或者我補充返。